righty. Good afternoon, everyone. Welcome back to week 2 of our Lunch and Learn health series. We're doing this, as we said before, in honor and memory of Dwayne Joseph. And so, we're trying to lessen the disparities in our communities, and we'd like to learn more about different how to take care of our health better. So today we have with us uh, Olivia Schmidt, MS, RDN, CDCES, and our topic today will be diabetes education and support. She's a certified diabetes care and education specialist. Thank you.
Wonderful. Thank you so much for the introduction. I'm going to share my screen now so that I have access to.
Sorry, I just wanted to say my co-chair is on here. I'm not sure if she can hear Miss Yvette Clergy. Thank you. We welcome you.
And I also just want to note that we're also joined by Naisha Carmichael from the Department of Health and Mental Hygiene, and who's going to be back with us also next week for a presentation on cardiovascular health. So welcome and thank you for taking time out today, Naisha.
Hi, thank you so much for having me.
Thanks, Sean.
Amazing.
Joanne.
Yes, so thank you so much for, the opportunity to be here. So today we're going to discuss a little bit about diabetes education, management, and we will discuss the resources that are available at the Brooklyn Hospital Center located in downtown Brooklyn, as that is where I do my diabetes education and our diabetes care program. So a quick overview on what diabetes is, right? Because it can be a little bit confusing for us sometimes. So diabetes is known as a chronic disease that affects how our body turns food into energy. So insulin that we have, it's naturally produced in our pancreas, and a person with diabetes either does not produce enough insulin or is unable to use the insulin that their body produces effectively. And this is something that can be known as insulin resistance. So when our body is not able to use insulin effectively, then the glucose or the blood sugar cannot enter our cells to be used for energy. And this causes a buildup of sugar in our bloodstream. So that's why we would test someone's blood sugar levels. If we see that the level is elevated, then we know that there's too much blood sugar in their bloodstream and not enough being used in their muscles and their cells, which means that something is not working appropriately in relationship to the insulin that this person may naturally be producing. So if you can see in the top right corner, we have a picture of a pancreas, and it goes over a healthy pancreas, somebody with type 1 and somebody with type 2 diabetes. So in a person that has type 1, and I will discuss it a little bit further in the next slide, that person is unable to produce insulin on their own. Therefore, the primary treatment option for them would be insulin as the primary treatment. They're not necessarily eligible for other medication options as their body doesn't produce any insulin at all. Where a person with type 2 diabetes, they may have varying degrees of how much insulin or how sensitive their insulin is in relationship to the glucose that they take in and how it enters our muscles and our cells appropriately. So there are different tools that we can use in order to help a person manage and control their blood sugar levels when they have type 2 diabetes. So for a person with type 1 diabetes, it is actually an autoimmune condition where the immune cells will attack the pancreas and it will destroy the body's ability to create insulin on its own. Therefore, a person will either need to have insulin injections or use an insulin pump for the remainder of their life in order to manage their blood sugar levels appropriately. We still recommend lifestyle and healthy eating because it makes it a lot easier to manage type 1 diabetes. However, diet and lifestyle will not help to prevent type 1 diabetes as it's an autoimmune condition. It can be diagnosed later in life, which is known as latent autoimmune diabetes of adults. It happens in a very small population of people, but it is something to be aware of. And but we mostly see it in childhood. So somewhere around 5 or 6 years old may be a common time that it is diagnosed. Type 2 diabetes, on the other hand, can be prevented through lifestyle modifications, so changes in our diet, changes in our eating patterns, and changes in our physical activity. And there are different risk factors involved with the development of type 2 diabetes, which I will address next. And we can do a combination of treatments for that person on an individual basis. Another type of diabetes that I wanted to just mention is gestational diabetes, which is when a person may experience diabetes during a pregnancy. So these are the different risk factors for the development of type 2 diabetes. So you do see that history of gestational diabetes and also a person who has been diagnosed with pre-diabetes. These are some risk factors that can put us at risk for the development of type 2 diabetes. So we want to be making sure that we're going to our doctor's appointments and checking our blood sugar levels to make sure that they're in appropriate ranges. A family history, advanced age, if we're not physically active, and there are other subpopulations of people that may be at a higher risk for the development of type 2 diabetes. So these are things we want to be aware of. When it comes to the diagnosis of type 2 diabetes, we will do something typically called A1C testing. So A1C is a blood test, and it measures our average blood sugar over a 3-month period of time. And the reason why it checks over that 3-month period of time is because our red blood cells will regenerate every 3 months, and our red blood cells are going to be what is carrying the glucose throughout our cells and throughout our body. So when they're carrying a large amount of glucose, we will see a higher A1C level. When they are carrying a lower number of glucose, we will see a lower A1C level. So that's why we would wait at least 3 months before testing that level again. Some people get it done every 6 months. Some people get it done every year. It just depends on individual factors for that person. And we use it for diagnosing and also monitoring pre-diabetes and diabetes. For people living with diabetes, typically an A1C level of 7% or less is the goal. However, there are individual factors which may influence a personalized A1C for someone based on their age and based on maybe other chronic diseases that they are living with. And you can see the A1C testing below. You can look that a person with normal blood sugar levels will have an A1C of 5% or below. A person with pre-diabetes will be in that 5.7 to 6.4% range. And a person with diabetes is diagnosed at an A1C level of 6.5 or above. So you might be asking yourself, myself, a friend, or a family member has been diagnosed with diabetes. What should I do now? So the Brooklyn Hospital Center is recognized by the American Diabetes Association as an accredited institute for diabetes management and education. So something that we teach is called DSMES, which is Diabetes Self-Management, Education, and Support. So basically, we offer patients the tools that they need to manage their blood sugar levels when they're in clinic and when they're at home. And since there are a lot of different factors that are involved to manage our diabetes, we make sure that they understand all of the factors that they need in order to reach their goals. So we have a team of people that we work with at the Brooklyn Hospital Center in the outpatient setting. We work to identify patients with an A1C of 8 or above with a primary care physician at Brooklyn Hospital. We also will see patients who are referred by podiatry or by cardiology or endocrinology. So they don't have to have a primary care, but that is what we typically will look for. We provide these patients with extra supportive care and outreach. So that includes a team of myself. We have medication management, which is also a one-on-one visit. We have social work for those who need it, and care managers to make sure that accessibility or any other issues that they need with coordinating rides or appointments is all helped for the patients who need it. So once we have people in this program, we track their progress, we assess the goals that we make and that we make with them, so that way they can succeed with these diabetes self-management skills and behaviors. So the diabetes care team makes up a bunch of different people. We're involved with pharmacy, care management, social work, myself, podiatry, endocrinology, cardiology, and nursing staff is also heavily involved with this as well. So as a dietitian and diabetes educator, I will be the one that enrolls these patients into the program, and I will track and report the patient outcomes, and I'll present it to the team. So what is the role of a diabetes educator? We'll do hands-on demonstrations. So if a patient needs insulin or other injectable medication, we'll teach them how to use it appropriately. We'll also test and for blood sugar monitoring too. We'll tell them how to use it. If they're using a traditional glucometer or a continuous glucose monitor, we'll do hands-on demonstration with that as well. We want to make sure we're there to support everyone. We want to listen and educate them, and we want to motivate them to make behavior changes. So these are the things we always consider. We do a person-centered and individualized approach. So if a person has difficulty with cost or access, we will help them with that. We look at the social determinants of health, and we will also look at their clinical factors. So certain medications may be more beneficial for people with cardiovascular disease or with chronic kidney disease, or for people who are overweight. They may benefit from different types of medications or different treatment modalities. So those are all things that we take into account. When it comes to lifestyle treatment, we look at healthy coping, how we deal with stress, healthy diet, physical activity. We make sure that they're doing all their prevention screenings and that appointments are up to date. And we'll also discuss their different medications. So what does healthy eating look like? It can look like different things for different people based off of our preferences and based off of foods that we like to eat. So we like to provide our patients with almost like a healthy eating checklist for managing diabetes. So things we like to look for is limiting our starch or carbohydrate foods to about 25% of the meal. We like to choose high fiber, starch, and carbohydrate foods. We like to use multiple non-starchy vegetables at our meals, and we like to try to do 2 or 3 meals per day using the plate planner guidelines. So that would be half of your plate being vegetables, 1/4 of that being our carbohydrates, and the other quarter being our protein. But what I wanted to highlight today is just in relationship to sugar sweetened beverages and how they tend to impact our blood sugar levels the most. So this is what a sugary drink looks like. We can see that there are many varieties, many options, many flavors for everybody's preference, I'll say. And these are some of the hardest drinks for people to let go of. Why? Because there's so many different kinds, and sometimes we're on the go, we don't have time, we want to just drink something, right? But these tend to impact our blood sugar levels the most, and this is usually the first conversation that we will have with most people during a visit. So why are these sugar sweetened beverages so harmful for our blood sugar levels? This is a chart that I have, and I'm not sure if anybody is familiar with continuous glucose monitors, but they will track different trends with blood sugar levels. So here I have an average glucose response to a regular soda and to an orange juice. And as we can see, we see a big spike and a big drop in the blood sugar levels. And the reason why this can be so harmful is because it can put stress on our pancreas and can cause imbalances with our blood sugar levels. So when we have a very high spike in our blood sugar levels, and a very low drop in our blood sugar levels, it can really have an impact on our metabolic health. It can actually negatively impact our mood. So some people that have blood sugar swings will actually might have mood swings. They will have a lot more difficulty managing their blood sugar levels when they are so variable. And sometimes too, if we're having the drink alongside a meal that's heavier in carbohydrates, our blood sugar levels stay very high for longer periods of time, and it becomes very difficult to manage that. We will go over different label readings. So there's sugar-free, reduced sugar, and no added sugar. So we'll always go over label reading to make sure that we're able to identify how much sugar is actually in a product. So if we see in the top the no sugar added juice, you can see it has 23 grams of sugar. So just because it says no sugar added doesn't mean that it doesn't still contain sugar. So that is something that we always like to educate our patients on. And as compared to something that is zero sugar, it will have zero in both categories. We like to offer some options and alternatives for low and no sugar drinks. These are some options that we may recommend to people depending on their scenario. So we like to provide people and empower people with options, not just to tell them to say no to everything. I think it's important, you know, to allow people to find new things that they find enjoyable. So these are some other self-monitoring things that we'll look for. So if a person is interested in smoking cessation, we do have that available through medication management, blood pressure monitoring, if that is something that is needed or requested. We'll make sure we're looking at diet and exercise, managing our stress, taking medications, all of the things that are needed for self-management. I wanted to throw in some exercise recommendations just as something to be aware of. This is something that we do discuss and talk about. So for the American Diabetes Association, they recommend about 20 to 30 minutes of exercise, either 7 or 5 days a week, of this moderate intensity exercise. So maybe it's going for a walk, maybe it's doing a Zumba class, maybe you're on an elliptical, maybe you're doing some house cleaning, and this can really help to improve our insulin sensitivity, and it can actually help to lower our blood sugar levels after a meal. So a 15-minute walk after a meal can really have a tremendous impact on lowering our blood sugar levels. And for patients that may be interested in weight loss, there is a higher recommendation for that level of physical activity. And we try to encourage 2 days a week of strength training, as that also helps with insulin sensitivity. So this is just an example that I pulled from one of the classes, just to kind of show that meal planning does not have to be difficult, it does not have to be expensive, and you do not have to spend all day in the kitchen because nobody has time to do all of those things. So these are some 3 very easy recipes that we have shared in the past, and I have links to the recipes below to look through, but one of them, for example, in the middle is the vegetarian quesadilla. So you're using some whole wheat, you're using a mix of vegetables, and that can be very beneficial because it's higher in fiber, and you're getting those non-starchy vegetables into the mix where it doesn't look like a typical salad, right? So that's another way of getting it in. Maybe it's a little bit more of a family-friendly option, which is something that we also like to keep in mind for most people. So things that we offer outside of the one-on-one visits at Brooklyn Hospital Center, we do different courses and events throughout the year. So we do an in-person diabetes class. We do a 6-class series where we focus on self-management behaviors, and we will do small classes. So they're between 6 to 10 people. So they're very intimate classes, and we just make sure that everybody is aware of how to self-manage their blood sugar levels at home. So this is good for people who like to take advantage of an in-person opportunity. We do some virtual cooking classes and nutrition classes throughout the year where we partner with Stellar Farms and the New York City farmers markets, and we'll provide these participants with health bucks that they can use on fresh fruits and vegetables at the farmers market. We will also do farmers market trips with them as well. We did a Diabetes Day awareness event this year for the first time. So this is some pictures from that, where we had different specialties and different patients there. In the bottom left corner, we have some people from our endocrinology department and other things that we have. So we're always trying to do community events because it is helpful for everybody to be involved together. So this is the information in relationship to Brooklyn Hospital Center, if anybody's interested in that information. And I also have my contact information listed at the bottom. And that is what I have for you today. I don't know if you have any questions on anything, but that's it.
Thank you so much, Ms. Smith, for the presentation on diabetes care. It's really informative and something that we can all find useful as either ourselves or maybe relatives may be dealing with this illness. Does anyone have any questions? Feel free to use the raise hand feature or to write in the chat. Okay, why don't we start with our chair, Ms. Brown, and then the co-chair, Ms. Changa-Jada.
Hi, thank you so much, and thank you for this presentation. Just a quick question about your in-person workshops and cooking classes. So are they open to the public, or are they only open to patients that are registered in your program?
So for the in-person series that we do, the 6-class series, we reserve that for patients that we have at Brooklyn Hospital, but for other community events, we're able to open that up to other people that may be interested in coming to get involved. We are actually considering doing a walk this year in lieu of an event for Diabetes Awareness Day. So that's something we're discussing, and we would be, if that's something we end up doing, we would like to have other people involved, right? So maybe other resources or other organizations or something like that. So we would do things like that where anybody could participate.
Great, thank you. And definitely consider us, send us announcements of your events. Thanks.
Yeah, absolutely. We're working on our calendar for the year, so I'll make sure I send it over.
Thank you. Ms. Changa-Jada?
Thank you. I just wanted to ask, in the classes, do you address wound care? Like sometimes I know one of the members of my church ended up doing surgery and has been in rehab for 4 years now because she had diabetes and just not getting proper care with the wound. So it's just now healing.
Right. Yeah, that can be really difficult, and I think that's a good thing to bring up because one of the things we do discuss is so in relation to blood sugar management, when our blood sugar levels are more controlled, we are able to see more effective wound healing because when there is high sugar levels in the bloodstream, we may be more prone to infection. So things we do discuss in relationship to podiatry is very big. So we'll go over foot care a lot, and that also will have to do with wound care as well, because we make sure that everybody's checking their feet to make sure that they are wearing shoes in the house, to make sure that they are don't have any cuts or sores that look infected. So we do always encourage people, and we'll educate them if they see that something doesn't look right, to go and, either speak to us about it and we can help them escalate it to where it needs to go, or to make sure that they're seeing their podiatrist annually to check for sensation and numbness and tingling at the bottom of their feet as well, because if they're not able to feel the sensation in the bottom of their feet, then they're not necessarily going to know if there is a cut or a sore there that is not healing appropriately. And if we know anybody that has a wound, then we will address that specifically with them.
Thank you.
Thank you. District Manager Campbell?
Thank you very much. Appreciate the presentation, and just a quick housekeeping note that in addition to those who are on with us right now, it's also being live streamed and recorded, and we will it will live on our website as an ongoing resource. So thank you for today and for all of the days ahead that people will be able to check in on this video. I had a question because you'd mentioned that you will do farmers market visits with your participants, and I wonder. And you also mentioned doing events. So I wonder if you ever sort of post up at a farmer's market. So as people come in, they can avail themselves of your services without knowing that it's there before they go. And my second question is, if you've talked about what's sort of the age diversity of people who participate, and how does it sort of square with the age diversity of people who would benefit from participating, if you understand my question about the gap?
Yeah, absolutely. So I think that to address the first part of that question, we are not currently at the farmers market, but I do think that is a good thing. When we started doing, well, we were doing the trips before. I was working there here prior to 2020, and we just started doing them again this year. And Grow NYC does have a station there where, depending on which farmers market you go to, I mean, they're always there, but if it's a less crowded one, you actually end up benefiting from it more because they will do cooking demonstrations there, and you're able to really see everything that's happening when there's not as many people around. So we go to the one in by Borough Hall because it's a close walk to where we're located. And we did exchange contact information with the Grow NYC participants and the workers and the volunteers there. So there might be something, some type of collaboration in the future. But yeah, I think that would be a good idea for us to do that. And also to Grow NYC, they also do classes where they will do bilingual classes in English and Spanish, and that you could communicate with them directly, and they can also assist to set things up if that's something that you have interest with your members in the future. They're pretty good, and they'd be more than happy to help you, and I could give you information for that as well if that's something you're interested in.
Great.
And in relationship to the types or the age group of the people that come, I would say it's mostly older adults due to the fact that I think that they are, due to the whole post-COVID world that we're in, I think that there is a higher degree of loneliness and a higher degree of wanting to be a part of something. And I think that our older adults tend to show up more to these in-person events. We definitely do have younger people that show up as well, but I do think that it ends up being older adults, and we do care for people on a spectrum. And I would say that in some way or another, the majority of people that want to come in person will, and we do some stuff online, which can be easier for people to access. If they have kids or if they're at work, then they can listen on their lunch break or something. So we have tried to find ways to reach the different types of populations.
Thank you.
Our next question is from Amy Bro.
Hi, can you hear me?
Yes.
I was just wondering if we could get a copy of the presentation after the webinar's over, and also if you could repeat the recipe link.
Oh, yeah, sure. I can go back to that slide if you want to, but yeah, I will send a copy of the PowerPoint to Joanne and Miss Campbell after, and then they can maybe distribute it. Okay.
That's great. Yeah, so this recording will actually be on the CB14 website immediately following this presentation. And if we have the static PowerPoint too, we can add that link so people can download it if they wish.
Beautiful. Thank you.
Ms. Changadata? You're muted.
Sorry about that. Thanks again. Now, I remember you said that you're working on like online classes to attract the younger population. Is that?
Yes,
That's-
so we were doing virtual classes before, and we recently transitioned to in-person because we see you can see a difference when people are interacting one-on-one. So we started those small groups, and then we will do virtual classes now. We're going to try to do them once a month, but right now we're doing them seasonally. So we did one for Thanksgiving, we did one in December for the holidays. We're going to try to do one in the springtime. So we're we're typically doing them around, we were doing them around lunchtime before, either a 12 to 1 or a 1 to 2, because anyone who's working can typically just kind of tune in at that time and receive the benefit. And that is how we're kind of separating those two currently.
Okay. And do you participate in health fairs? Because my church is planning on having one, and I really do hope that this kind of presentation, or at least some kind of presentation, could be made, because there are a number of youth and young adults in our congregation that have type 2 diabetes, and a couple that I know of that has type 1.
Yeah, absolutely. So we do health fairs. There is a community outreach coordinator, which I could get in touch with you directly, and I could also link you with her. But also, if I'm aware of the date of the event, I'd be more than happy to coordinate that with you.
Yeah, I believe it's in June or July. I forget the date right now, but I can go back and verify.
Yeah, no problem. That would be fine.
All right, thank you.
And if you need, we can get the community coordinator involved. They'll also do blood pressure screenings as well. If that's something that you're interested in, they'll do that and bring that to health fairs as well. So we could also provide that too.
Yes, thank you.
I have a two-part question. The first part is kind of like around educating the younger generation. I know a lot, there's some people who are like millennials or Gen Zs or those who are in college age. Are there any resources or programming in terms of getting their attention and making sure that they are aware of the risks in terms of developing type 2 diabetes? I don't know if there are any partnerships that Brooklyn Hospital has with local colleges and universities in Brooklyn to help with education and support.
So when it comes to young adults, um, as far as partnerships, I'm not sure if we have anything right now. I can, though, discuss with the Children's Health and Pediatric Department to see if they do anything in particular, because there is pediatric endocrinology that we have available. I don't work in that department directly, but I can inquire about that, and I could let know if I find anything out. And I think that it's something that needs to be maybe a little bit more well established at this point. But if we do see someone who is a younger adult that comes into our clinic, then I think maybe our approach, sometimes is a little bit different, because we would speak to them in the same way, and we would do the same things. But there's something that we have come across with patients with diabetes. We like to kind of discuss it or explain it as the road to acceptance. And it happens a lot of times where we'll talk to people and they may have been diagnosed when they were younger, but they just weren't ready to accept it. And then found it really challenging at a younger age. But then something happens at some point, whether it's something that happened to them or a family member or whatever the case may be, when they become ready to accept it. So when we have someone who is younger, um, I think we take a different approach in the way that we address it, just as making sure they receive that education, and it may need to be a little bit more ongoing, and they may see the benefit after maybe a longer time period than someone who is an older adult, just based off of the way, because when you're young, you feel invincible, right? When you're older, you're like, okay, I'm not that invincible anymore. So I think it's just taking that into account, which is something that I mean, honestly, I just learned that by talking to people. So yeah, we should be doing more in relationship to that, but it gives us good ideas to consider.
Thank you so much. And I think especially, as you're saying, people are younger and they're like, oh, okay, I may potentially have this illness or disease, and they may not be taking as many active steps to help address the condition. My second part of the question is in terms of you were mentioning the support team at the Brooklyn Hospital Center, and I'm wondering if there's any help for people who maybe has experience after being diagnosed with diabetes, are now experiencing depression, anxiety, or other mental health illnesses. Are there mental health support for these individuals?
Yeah, I think that's a great question, and it is something that we try to, so we try to address them with, when I do my one-on-ones, we'll discuss healthy coping techniques, and we'll try to break that down. Of course, I'm not a therapist or a psychologist to any degree, but that is something that we go and discuss. When a person needs something outside of some general education, then we will refer to social work. Social work provides counseling resources either outside or inside. We do have a telepsych nurse practitioner that works at the Brooklyn Hospital Center, and so depending on whatever the patient is dealing with, they may be a good fit for that, or they may be a good fit for something outside. And that's when I'll refer to the social worker, and they'll meet with the patient to help determine the best course of action.
Thank you so much. Ms. Rowe.
Thanks so much. When I do Medicare advising and tutoring, people ask me diet and health questions. And my question is, if you don't have diabetes, is the diabetic diet healthy for you generally? Because I just try to motivate people by saying, this way of eating not only helps you with diabetes, it's just really healthy, but I want to make sure that's true.
Yeah, I think that's an extremely valid question. And yeah, I would say that it's going to be very beneficial for anybody with or without a diabetes diagnosis due to the components that it has. So we really try to focus a variety of those non-starchy vegetables, and that's going to be helpful for people who may have high blood pressure, may have high cholesterol, maybe they have some GI issues where they have difficulty digesting certain foods. It can help kind of move things along, and it's, I would say, generally well tolerated for most people. We also will say a Mediterranean style diet can be very beneficial for the general population as well, but sometimes that takes away from like cultural preferences and can be a little bit more challenging, I think, to take into account. So I think that like a diabetic style diet would be appropriate for, I would say, the majority of people.
Thanks.
Ms. Chang Jada.
Thank you. I wanted to ask about the parents with gestational diabetes. Like, are there classes or are they informed? Are they encouraged to, like, after they have the children, is there follow-up or there teachings to say, maybe to encourage a healthy eating for the parent as well as the children? Because I've known some parents that develop gestational diabetes that are now diabetics, and their children, a couple of them I know of. One, the one has a daughter that's 12, and one has a son. He's a teen, and they've developed diabetes as well. And so, the lifestyle, the eating habits are like, and it's pretty serious because the little girl, she had, I think the grandmother said her sugar levels were up to 300, but the mother wouldn't take her to the doctor. So just wanted
Right.
to ask that.
Yeah, no, it's a valid question because, there are different factors, right? So there are genetic factors and there are lifestyle factors. And I think that's why we do try to focus on that self-management, because education, I could tell you one thing, but what you decide to do at home could be totally different, and that's not gonna go anywhere or really help anybody. So it's just really trying to reinforce those behaviors. So when a patient that has gestational diabetes, I know that they meet with medication management there, and which is one of our pharmacists who I work with, and she also discusses lifestyle, healthy eating, things of that nature, because the the type of diet would be very similar. There are a little bit of differences and nuances. If you've had a child before, there are certain foods that you can and can't have during pregnancy. So those are things we take into account, and they may have lower blood sugar targets than a person with type 2 diabetes. So there is a lot of education involved there. As far as afterwards, I think that for us, when sometimes I see people for weight management who have a history of gestational diabetes, so I'll always have that discussion with them. If it's a part of their medical history, and I will say that most of the providers that I work with will definitely keep an eye on those things, because they do have an awareness to it. And if they think that somebody needs maybe just a one-time education, then they'll refer them to me or my coworker, just to kind of rope them back into what should be happening. And we'll discuss eating well for the family too, because a lot of people will say, like, well, now I have to cook two different meals. I have to cook one thing for me and I have to cook one thing for my kids. And it's like, well, not really. We could try to do both, right? So that's also something that so there's varying degrees of it, but when a person is brought to my attention, or to like medication management's attention, or to the doctor's attention, then yes, we do have that. And I know that my counterpart, the pharmacist, she will have that conversation with people if they're at Women's Health during pregnancy.
And thank you for that. This is very informative for us. And I also wanted to ask about amputation among the younger people or young adults. Have you seen any of that at all, or no?
So I would say that amputation is typically not as common as we imagine it to be. I think that will it will happen typically when a person has very high blood sugars for very extended periods of time, and how those high blood sugar levels impact our nerve endings is individualized for different people. I don't know if we know exactly, how we would know if a person was at higher risk, if they have other vasculature issues, or maybe they've had a DVT before, or if they have other cardiac issues where the blood flow or the circulation is not working as effectively as it could. That person may be put at a higher risk for the development of an amputation. As far as younger people who I have seen, there's a very small handful that I've interacted with, and I don't think that for us it doesn't seem to be the majority of people that we see.
Thank you.
Thank you. Ms. Rose, do you have another question?
I actually didn't know how to get the little hand off my screen,
Okay.
but I thought of another question if I'm not being too
No, go
monopolizing.
ahead.
A doctor I used to know described diabetic blood as being thick like syrup. Do you guys think that's an accurate way to try to explain it to people, that the sugar makes your blood sticky and thick?
Yeah, I think you could describe it that way. Let me go to the first, one of those first pictures that I have. So when we think of blood sugar levels that are high, so you can see this bottom right picture where we have these, this is a picture of a vein. I don't know if it's, I can make it a little bit bigger, maybe that's easier. But we see in the right, it would be something with high blood sugar levels. There's a lot of white dots, right? So that means there's a lot of sugar hanging out in the bloodstream, and it's not really supposed to be there in high amounts. And so that can potentially change like the viscosity of the blood. Where we see on the left-hand side, we always need some sugar in our bloodstream, so then you'll see that normal blood glucose. So you could, yeah, I mean, if you feel like that makes a more of a visual of a picture for somebody, you could also just say it's just that there's a higher amount of blood sugar in our system. And that's why physical activity can be important, because when we are doing more exercise, we can actually shift the sugar out of the veins into our muscles and our cells to be used more effectively for fuel. And that's why we see lower blood sugar levels with exercise after meals and just regular physical activity in general.
Great. Thank you.
Are there any additional questions? Ms. Campbell?
I was just going to jump in only if there are no additional questions to see if Ms. Carmichael from Department of Health and Mental Hygiene wanted to make any mention of some of the resources are on the DOHMH website, or give us a preview of coming attractions for next week.
Hi, I joined just to see how the agenda would be going, just to get a brief overview of what I'm expected to talk about next week. And I think Olivia, she did a great job, and our presentation is about, I want to say, an hour, but I will try to break it down just a little bit to have this kind of a discussion where we can go back and forth. And I will definitely bring and share any resources that we have in office.
Great, appreciate it. Everybody I've ever worked with at Department of Health and Mental Hygiene has always been so resourceful and helpful and wonderful. And Tejumade is one of my favorite people. I don't know how closely you get to work with her, but she's just one of my favorite people in city government. So we look forward to seeing you next week. And Olivia, thank you so much. I'm not the formal thanker, so I'll jump off now, but thank you.
No problem.
Does anyone have any last questions? Thank you so much, Ms. Smith, for this presentation on diabetes education, management, and resources, and for joining us, Community Board 14, for our Lunch and Learn series happening this month of January. Thank you to all who attended and participated in today's session. The recording and presentation slides will be on our website shortly. If you missed last week's presentation on diabetes prevention, I encourage you to check out our website and also to join us next week. We have 3 more Lunch and Learn sessions happening on Wednesdays from 1 to 2 p.m. on the 17th, the 24th, and the 31st. And we also would love to have you encourage your family members, friends, and neighbors to join us as well as we kick off the new year and focus on health and wellness. Thank you again, everyone, and have a wonderful afternoon.
Thank you.
Hold on, there was someone.
Oh,
Sorry, there is someone.
oh, there's someone with a question.
Yeah.
Sorry. Antonia, I'm sorry I missed you.
Hi, my name is Jay. I'm the assistant branch manager at the Cortellu Library on
Oh,
Cortellu Road. Hi, I
hello.
just wanted to ask, I found your presentation fascinating, and I wanted to know if you're able to do a presentation at our branch at some time in the very near future, because we found it fascinating. I think it would be very beneficial for the local community over here in the Cortellu Road area.
Yeah, that would be great. If there's a way of, to assist with exchanging of information, I'd be more than happy to, get in contact.
I'm here for that. If it's all right, Olivia, I will forward your email information over to to Jay and Antonia over at the Cortellu branch.
Yeah, absolutely.
And you
Anyone
can
that,
connect directly.
yeah,
Yes, sure.
anyone that has interest, if they want to discuss, I don't know, anything, you could feel free to give my email out to whoever inquires.
Yeah, it would be most welcome. I think people, especially the general population, but especially the older population, I think a lot of people could benefit in this area uh, from your dietary tips and also lifestyle management and things of that nature.
Yeah, thank you.
Yeah, thank you.
Absolutely.
Thank you so much.
And I want to say thanks also. Thank you, Sean, and thanks to Joanne who invited you, and thank you for this very informative presentation. And I'm looking forward to hearing from you, and hopefully that you can be there for our health fair in the summer. Thank you.
Absolutely. Thank you so much.
And thanks to my co-chair who's so graciously and eloquently informed us and reminded us actually of the next 3 Lunch and Learn series. So thanks everyone for tuning in, taking time out of your busy schedules. Please share the videos. Thank you.
Thank you.
Hi, Corazon. Okay.
Oh, no. Hi and back. I was just trying to unmute. This was great. Thank you guys.
You're welcome.
Bye.
Great
Take care.
job, Yvette. Great
Thank you.
job.
You too, Florence. Yeah, take care, everyone.
Okay,
Bye
bye.
bye.
I don't know how to leave, so I'll leave last.
Oh, okay. I think I can end the meeting. So maybe this will be it.